I'd like to introduce to you Ms. Sonia Hartman.
Hello, everyone. I know I got you at the end of the day, and you're probably ready to go and go on over to Punch Bowl Social and bowl and have some fun and all that good stuff. So we're going to get through these slides. My PowerPoint presentation is on the link. If you go to the actual website for the conference and click the materials item, you'll see the PowerPoint on that underneath there if you actually want to follow along. I may not cover every slide that's in here because sometimes I get ahead of the slides. I typically don't stand still when I talk or present either. And if you have a question, let me know. If I accidentally say an acronym you don't know, let me know because we're so used to using acronyms. But as Julie said, I've been with Travis County for 34 years. I started when I was 10, maybe 5 if I want to stay under 40. But I've been at Travis County for 34 years. I spent the first 20 years of my career at juvenile probation, working all different positions, and then I transitioned to Health and Human Services in 2012. I have been a care coordinator that implemented the wraparound process. I have been the CRCG coordinator for Travis County. I have been the chair, co-chair of our CRCG, and now I oversee our system of care program as well as chair our CRCG. So I'm going to talk a little bit about CRCGs, and at the end I'll talk a little bit about Travis County CRCG and why we're kind of unique and different than a lot of the other CRCGs in the community. As with everything, especially if you're brand new, so how many people have been chairing a CRCG for more than 5 years? So I can kind of see what I got in the room. 3 years, 2 years, 2. Okay, anybody just new to the position? Anybody that just don't know what a CRCG is and they just 4 letters to you? Okay. Is anybody in a county that does not have a CRCG or has a CRCG but they're not active? Okay. So, like with everything, I thought about this presentation, and what you'll see is my perspective on some things and how I see it, because I've been doing this work for a long time. I'm going to start out with the history. I am not going to read every slide about this history. You guys can go to the state CRCG website, just like I did, and read the whole history. I have cut and pasted and added it into my PowerPoint. So I thank them for having that up there. But I think you need to understand, where did it come from? Why are we having this meeting? Why is it so important to have all these community collaborations and getting all these agencies on the same page, at the same table, and working with these children, youth, adults, families, or providing resources, whatever it is that your CRCG does? So some of our objectives today is we're going to understand the purpose, the process, and the practices, and how it is not a cookie-cutter format. No matter what CRCG you go to, they're not always going to be ran the same. They're not going to always follow the same format. Their referral forms, their paperwork is going to look different. Understand management, recruitment, and sustainability of partners. You cannot have a CRCG by yourself. You have to have people at the table. So how do I get them there? And how do you manage that meeting? As a chair or as a co-chair, or even if you're trying to build up that CRCG that once was. And understand how CRCG and system of care values go hand in hand. So this is the history. So back in 1987, the Texas legislature, just like the legislature always does, they had this great idea. And their idea is that there were kids being lost between the cracks in Texas. There were kids out there that had mental health, intellectual and developmental disabilities, medically fragile, serious emotional disturbances, all kind of challenges going in, and had everybody's hands in the pot. CPS, Juvenile Justice, private entities, hospitalizations, RTCs, whatever it may be, and those kids were falling through the cracks. Their needs were still not being met. So they said, why not come together and have this one spot where families can go and meet with these agencies, discuss or talk about the challenges that they're having with their children, and get resources. Let's create this one-stop shop. That's not how they worded it. That's Sonia's interpretation of what the legislature was doing back in 1987, right? And they required 8 public agencies to work together to do this. In 1988, the model was established. Henderson, Tarrant, Travis, and Valverde counties were your pilot counties. So Travis County has had a CRCG since 1988, 1989, when we were one of the pilot counties. That CRCG has been modified, it has changed, it has grown, it has become better. And yes, I'm biased because that's my county. But over the years, it's always been there for children and families. The one thing the legislature did not do was give y'all some money. They said counties go forth, 252 counties in Texas. Some of them the size like this, and some of them like Travis County, large, or Houston. But they didn't give you money on how to do this CRCG, or to pay people to put it together, or who was gonna house it, who was gonna run it, who was gonna be in charge of it. So, in 90, the state CRCG team, that's when they established the MOU, right? The MOU that mandates the certain state agencies come together and be present at the CRCG. Right? 91, we got the local training materials. They were disseminated. They brought in an outside consultant to work with counties. And the highlighted ones are the ones I thought were important, because you have to understand where we started and where we are right now, because it's kind of like a circle. It's kind of also like working with our families. It's up, down, backwards, sideways, and then we go back to what we thought worked in the first place, which is what the legislature did. So in 96, the legislature said that CRCGs had to be notified when children and youth with developmental disabilities were placed in nursing facilities. Did y'all know that you guys were supposed to be notified when those kids were placed in nursing facilities? You're supposed to get a letter stating that a child, whether that child is in your county or out of your county, but they're placed in your county, they're supposed to notify you to let you know that that child is in your county. Right? CRCG for children were going well, that the adults actually got in on it, and they created CRCGAs for adults in 2000. 2001, this is when they said that you also had to be notified when a child went into an institution, a state-supported living facility, or even a foster group home within your county. I think I was the CRCG coordinator then. I was receiving those letters. I even went out to visit the facilities. But they would send you a notification that says, Johnny was placed at whatever the name of the facility is from this county, to let you know that he's in your county, right? Then you had another MOU between the adult and child serving agencies of CRCG. And TIFI, you guys, that's an old word. That's the Texas Integrated Funding Initiative. We had TIFI way back in the day at the beginning of CRCGs, and they worked, right? And they joined the state office. So CRCGs went into the Office of Long-Term Care Services and Supports, right? They were not their standalone agency like they are now, or program. 2004 is when the data system came about, right? They created their internal data system. It's different than the data system that they use now. The data system now is well improved over the previous data system, because I used to have to enter in that old data system, right? And then in 2004, CRCG and TIFI offices were merged, right? Underneath the Office of Programs Coordination for Children and Youth. At one point, the CRCG office was not there. I can't remember the exact year, and I might not have highlighted. We lost the CRCG office. We lost that state support at one point, It was hidden in some other program, but it didn't have people that were running it. We didn't have a Julie or a Sarah or 3 to 4 staff that were working solely on state CRCG. So in '84 is when you got the other MOU, requiring a joint MOU between Health and Human Service agencies, state agencies, and state level partners. 2015, when were CRCGs mandated? 1987. So you're looking at 18 years later, you're just now getting another MOU for these mandated partners to be at the table. And this is when CRCGs were asked to create a report to give to the legislature. Remember those surveys that come out? They send out surveys that say, please complete this. And they're always asking you to do your data. That data is important because it gives them the ability to write the report, to take to the legislature to say, this is working. This needs to be funded. This needs to continue. These counties still need this support. In 2016, there were approximately 140 distinct CRCG groups covering 236 Texas counties. We have 252 counties in the state of Texas. 54, okay. Susie's helping me out. My math is bad. We have 254 counties. That's even, I mean, we're a huge state. And some of the CRCGs have to be combined. You have one CRCG for 2 or 3 counties, or you have one CRCG coordinator covering 2 or 3 counties, right? 2017, we all saw this where they also mandated that TJJD refer children under 12 to CRCGs for services. Coordination as an alternative to adjudication. Everybody had an interpretation of how that was supposed to be done. We work closely with our Juvenile Justice Department, and I don't think we staffed anybody under 12 to defer them from adjudication when this came out. I don't know about other counties, because everybody was trying to figure out, well, how do we do that? Is it that we just identify them? Because CRCGs have requirements. And every CRCG is different. Not all of them staff children. So in 2018, the Office of Mental Health Coordination received funding to hire 2 more people. So now you have a staff of 3 that's running the CRCG office, the state CRCG office. You have 3 people that are supporting 254 counties and 140-something CRCGs. And their job, or part of it, is to figure out why there is not a CRCG in every county in Travis County. I mean, every county in the state of Texas. And it's to get to the point where every county has a CRCG, even if it's blended into another CRCG. So in 2020, we had 145 CRCGs. In 2023, and I got this information from Ms. Regine, just the other day, we have 146 CRCGs, 144 that are active and 2 emerging. And they're covering 242 counties and then the 2 counties that are emerging. So we still have 10 counties that are inactive or don't have a CRCG. So that's where we're at right now. And that's a little brief history of CRCG and why this work is so important. And why it is when you're doing this work that it's impacting our communities. And why the state CRCG office is going to the legislature, they're hounding you to get your data, they're asking people to input the data, is so that we can say that the children, families, youth, adults that we serve within every county that we serve need assistance. They need help. That we have needs that are being unmet. There are barriers. And how do we break down those barriers? You cannot do that without data. Nobody's going to magically give us dollars. We have to show that the need is there. These are the state mandated agencies that have to be at a CRCG or they're part of the MOU. So you got the Texas Health and Human Services Commission, Department of State Health Services, or DSHS, Family and Protective Services, or CPS, Housing Community Affairs, TEA, the Juvenile Justice Department, and that's usually a representative from your Juvenile Probation Department, Texas Workforce Commission, and then the Texas Department of Criminal Justice, and then you have the Takumi program as well. So these are the mandated, these are the agencies that are in the MOU that state that they would be at CRCGs. Those that chair or run or attend CRCGs, do you have all these agencies present? He's over there. Nope. Nope. And I can tell you, and we've been in existence a long time, we don't have all these agencies present. We have quite a few of them, probably a majority of them. So how do you get those people to the table, right? How do I run a CRCG? How do I create it? How many of y'all were voluntold to be your CRCG chair? You can raise that hand. We're not going to tell whatever county you're from. I'm not even going to ask you what county. Raise your hand. He's the coordinator. She was over there like, I was voluntold. I'm going to put my hand up. How many of you guys are paid to be CRCG coordinators, chairs, whatever? One, right? There are about maybe 5 counties that have paid positions, somewhere in there. 5 to 8 counties that have paid positions that support CRCG or the CRCG chairs. That one that raised her hand, you guys cannot have her. You will be jealous of her or jealous of me in a little bit because I couldn't do the work I did without that one over there. So, but you guys cannot have her. You can admire from a distance only. So what's it really all about? It's not about the meeting. It's about the collaboration. It's about having family voice at that table. It's about having agencies there. It's about coming up with different ideas and creating a plan. It's about circling that family with supports and services, and it's about community partnerships. It's not about DFPS, the school district, juvenile justice, what they are and are not doing, because at the end of the day, it's not their kid. It's our kid. It's our community's child, right? And by time families get to our CRCG, they have exhausted a lot of community-based services. And so we are providing, I like to say a one-stop shop for families. They're coming in, they're seeing all these agencies around the table or on the screen, whichever one you're doing, and they have the opportunity to ask for services and supports, to tell their journey, to share what's going on in their lives, even if you have the resources or don't have the resources, or even if you can't think of the resources, the fact that they have somebody sitting at that table hearing them. And that's what the legislature wanted us to do. They wanted us to provide a space for families to feel safe, to share their journey that they're having, or for adults to come through that door and share their journey and ask for help. It is hard to ask for help. It is hard to come to a room full of strangers and tell them about your business or what's gone wrong, or tell them about your child who's assaulting you. Mental health has not always been accepted. It's still a lot of stigma with it, no matter how proactive we are about acceptance and awareness of it. And so when we're there and we're around that table, it has to be a safe place. It has to be non-judgmental. And we have to have the right people at the table. If I come into a room and everybody at the table works for adults and my child is 12, you're not helping me. You're just giving me some more phone numbers to call. So it's really looking at who are we serving? What's our community? And how can we collaborate and build those partnerships so that families don't have to keep knocking on 30 doors and being sent to 10 different meetings to come back to the first meeting that they were sent to in the first place.
Sonia, I think we have a question.
Good afternoon. And I think you kind of touched on it, but how can you get all the players to the table or encourage at least those mandatory ones to get in the pot with us all.
It's coming up. You're ahead of me, Bettina, but it's coming. We're going to talk about that. So there are several types of CRCGs. There's child serving, adult serving, family serving, or a little bit of all. So you have to know what your CRCG does, right? Who are they serving? And if you're creating a CRCG or you're re-energizing one or working in one and you think you need to change it up a little bit, who are you going to serve? Because that's what your community needs to know, right? Because the people around the table have to meet the needs of who it is that you say you're going to serve. Who needs to be at the table? Our MOU partners. We would love our MOU partners to be there, right? You got to figure out how, and we're going to talk about how to keep people at the table. Nonprofits. Are there nonprofits in the community that you can bring to the table, right? For-profits, local agencies, community partners, persons with lived experience, parents and caregivers. To stay true to the values of system of care, you have to have parents or caregivers at the table. If you can get a youth or a youth voice at that table, that's wonderful. That is a struggle we have struggled with in Travis County, is having that youth voice there. But you gotta get people to the table. And how do you get them there? Oh, come to this meeting. It might last an hour, it might last 6 hours. I'm not really sure what we're gonna do, but just come. You gotta have a buy-in. You gotta have that elevator speech. You gotta let them know what they're coming for. How big should your CRCG be? You know, how many people, where is she? Where's my lady at? Miss Volunteau back there. How many people are at how big is your CRCG normally? 6 to 12? 8 to 10. Who else chairs a CRCG or attends? How many? 12 to 15. It varies. It varies from county to county. I mean, we would love to have, and you got to say, when is it too big? You have to think about that too, right? And are your needs being met with the partners that you have at the table? I would love to say that you're going to get every mandated entity to that table. You're not. But you have to work with the ones that you have and nurture those relationships and build new relationships to get the ones that you want there as well, right? And that's how you determine who should or should not be present. I know at our CRCG, everybody's not at the table. Like if somebody calls and say, I want to join your CRCG, what for? What purpose? What are you bringing to the table? What knowledge? What program? If you're coming to elicit somebody to utilize your service, that's not the purpose of our CRCG. We're not there for you to get business. You're there to bring your knowledge, your expertise, your experience to the table regarding resources, support, services, and programs in the community that might serve and help the families that we work with. At the same time, representing your agency. So you got to figure out, why are they coming to the table? That requires interviewing them. You know, it's not about, oh, okay, so you're this, oh, okay, your new program, okay, and what do y'all offer? Oh, okay, you can come. No. You have to vet those people, because the families we serve, the children we serve, the adults we serve are putting faith that we've vetted the people that are at that table and that they're bringing something useful. Is there a process to determine who should be at the meeting as a member? That is determined by every county. There's a new membership guide on the state website. There's a toolkit for how to build a CRCG and things of that nature. And we just talked about this in our CRCG luncheon, meet and greet or luncheon that we had over the lunch period. It's really up to each county how it's done. So a lot of times, if it's a new CRCG, they get all this toolkit from the state, but they're still going in kind of blind of what they want. It's like building a house and not really knowing what the foundation should be. So you have to figure that piece out, right? because every county's different. I wouldn't know how to start a CRCG in a rural county. I've only been in Travis County, right? And my thing would be, why are we not meeting? Well, that's because they 2-3 hours away. Okay, I don't understand that because I'm not in a rural county, right? I've only been in Travis County. So what we do in Travis County or what they may do in Harris County or any other big county doesn't apply to maybe a smaller rural county where they're covering 2-3 counties at one time and the resources look different. Purpose of non-MOU members being present, because your membership represents your community. It's not just about the partners that are mandated through the MOU or what the legislature said we had to have, but it's also about the community in which you serve. So you have to have those other partners there because they're the ones doing the work in the community. Can I screen out someone who wants to join my CRCG? I'm going to say yes, we do it. Another county might say no. If they're vetted and they look good, we're going to bring them because we just need everybody at the table. So it really depends, right? The state doesn't say yes or no to that. They're going to leave that up to that CRCG and to that chair. And I know a lot of you guys have other jobs besides chairing CRCG, right? Some of you are voluntary chairing a CRCG, and then you still got this full-time job over here. So these other duties and responsibilities come with chairing that CRCG. Especially if you don't have anybody else to help you out, then you are the sole person doing it. How do I get members to the table? So you have your MOU. You have to communicate with people. You have to set up meetings. And sometimes it's not the person that's on the ground doing the work that you have to talk to. You have to talk to the boss of the boss of the boss. And sometimes it means bringing in your director or your executive director or whoever is above you to talk to that equivalent in that other agency and entity to get them to buy in to what CRCGs are about, to get them to understand that MOU and to share it. So sometimes we can't always do the inviting. Sometimes we have to bring in other people to help us to get those higher level individuals in agencies to buy in, and then they trickle it down to the staff that need to be there, right? One of the things with MOUs too is some of those agencies might not have one staff that they can send. It's okay, rotate your staff through. We're fine with that as long as there's somebody there, right? You also want to look at, like for Travis County, and there's a housing agency that's part of the MOU. The state housing agency can't really, I mean, they can come, but we need somebody local. We need somebody that's boots on the ground in our community because the county is so big. And so we would need somebody that knows what's going on in the community versus somebody from the state level, because we had a state level representative at one point. But they didn't meet the need of the families we were serving, right? Because we're looking at people who are, maybe living on the east side that need housing, but we need to talk to the Section 8 office or the HUD office, and he's up here at the state level doing maybe legislative work. That doesn't apply to the families we're serving. So you also have to look at who are you asking to come to that table. You have to have a clear understanding of what you want. You want somebody that can make decisions, that knows about resources and supports, that knows who to contact if they don't know who to contact, and be able to follow through. You don't want a body. I can go get you a dummy for a body. You want somebody that's going to be open, that's going to participate. And participation does not mean I'm sitting at the table. Participation is I'm talking, I'm collaborating, I'm giving input, I'm giving ideas and suggestions. I'm reporting back if we've had involvement with this youth before and what we offered, or what I can offer, or who I can connect them with. That's participation. 20 people around the table doing this don't help me, because I don't know everything. And my job, when I'm the chair, is focused on the family. So I need other people to help me with the ideas and suggestions and recommendations and all that other good stuff. Mutual mission and vision. What is the mission and vision of your CRCG? Think about doing bylaws if you don't have bylaws. Think about doing, or even if you don't want to do bylaws, but come up with a mission and vision for your CRCG. What are y'all working toward? Why are families coming? What is the purpose of me sitting in this room once a month, once every other month, twice a month for Travis County's sake for 6 hours a day? What am I doing? What is my purpose? What is that purpose, vision, mission? And is it something that everybody at the table can buy in on? Another purpose of it is non-duplication of services and supports. I don't know about y'all. Travis County is a pretty decent resource-rich county, but we still don't have enough resources to meet the needs of our families. We still got to pool our resources together. We don't want to duplicate because that's taking something from another family. So part of that collaboration is also looking at how can we support one another. So if the local mental health authority is involved and that kid is in Yes Waiver and they're going to get these services under Yes Waiver, then maybe I can bring in my program and I can do this for the family because Yes Waiver doesn't cover family services, right? So I can bring this in. We're pooling our resources together behind the scenes. Doesn't impact the family, but they're getting something, right? We're talking. We're bringing them people to the table to say, hey, what's up? What's going on? So when you're inviting these members, one of the things I would recommend is, you have those HIPAA-compliant release forms, and we're going to talk about ROIs, so that agencies can give input if they've worked with them. So you'll know whether or not there's an open CPS investigation, and you can invite that investigator there to get an idea of where it's going. What are they offering? What are they doing? Mutual investment in the lives of those we serve. I really believe it is a calling to work with the children, youth, families, and adults that we work with. And so you have to have that investment to serve them because it's not the easiest population to work with. It's kind of like when I was a juvenile probation officer, they'd say, I'd take 10 boys to that one girl, right? And she's shaking her head because she knows what I mean. Sometimes nobody wanted to work with the girls on probation. They'd take 20, 30 boys over that one girl. And it's the same thing. It's having that commitment to work. Families are fed up, they tired, they mistrust you, they've already had their kids taken, and you coming in promising this and that with all these initials behind your name, but what you gonna do for me? That's what they need to know. Is how are you gonna help them? How do we give them hope that things will get better? That resiliency is real within their lives. So, you get all these people here, and you identified who you want to go. How is that meeting going? Do you have a chair? Do you have co-chairs that facilitate the meeting? Does the co-chair write any of the recommendations down, and the chair keeps everybody in order? Every meeting is different. Do you have releases that day for people that come to the meeting? Do you have a standing membership that lasts a year along with some training? What does it look like? Right? We have a chair in Travis County. That's me. And then she's not in here. I don't see her. We have a backup whenever I need to take a vacation, because every once in a while, chairs need to go on vacation too. And so then I'll have to see if Lisa can cover. And if Lisa can't cover, my director was the old chair, so then I have to ask her like a month in advance to make sure her calendar is clear to cover it. But you got to have that, right? Because life happens. We get sick. Our kids get sick. Sometimes we just can't make it, but you can't cancel the meeting if you got everybody coming. So you got to have a backup. Note takers, timekeepers, and if you guys do like meeting minutes and you review minutes and stuff like that, you got to follow Robert Rules of Law. But you got to have a note taker. The chair cannot facilitate the meeting, take the notes in attendance, and then disseminate the notes to whomever's supposed to get them. They got to have help. Sometimes you have to volunteer people to help out because it is a community resource coordination group. It is not Bertha's resource coordination group. You know, it's not this young lady's resource coordination group. It is a community, which means we all work together. If you give that family something when they leave, like if there's a list of recommendations or a plan, whatever you call it, who's going to do that? If the chair's waiting to meet the next family or whoever's coming in and they're chairing, how are they going to stop the meeting and then go do this too? They need support. So if you're in a CRCG and you're just sitting there, volunteer, help out. Because it's needed. Families need to know that the meeting is organized and that we're attentive and that we're listening and that there's going to be a result out of this meeting. There's going to be a product. It might not solve their challenges or problems or anything that's going on, but they need to know that they were heard. Do you have a referral process? How do you get your referrals? Does families know how to make referrals? Do you only take referrals from juvenile probation? Do you take referrals off of the, can they call in on the internet? Then can they call just the chair? How do they get it? You got to have a formal process that people know about. And yes, does that mean you got to get out there and share the word and speak the word about CRCG so people know what CRCG is? Yes. But you got to have some type of formal referral process. If you don't know what needs to be in your referral form, the state also has a referral form on their website that you can modify and adapt. You don't have to reinvent the wheel because the wheel's already been invented. It's been invented since 1987. And that's why we have a sustained CRCG office, because they're creating all these documents for people to use. Where are you going to meet? Okay, before COVID, a lot of CRCGs met in person. Since COVID, we've been virtual. Some people have hybrid. Some people are back in person. You got to figure that out. You just can't wake up one morning and say, this is a good day to have a CRCG. Right? So you have to have a planned calendar of a dates, whether it's the second Thursday, the fifth, the third Wednesday, whatever day you guys meet in your CRCG. But it needs to be consistent. Sometimes some CRCGs I know don't meet unless they have somebody to staff. Some of them, if they don't have a family to staff, they'll have a meeting and go over business or do trainings and stuff like that, and that's fine. But at least let people know. I think it's harder to keep people at the table if the meetings are inconsistent. Or they don't know if they're going to have it this month, but they're going to have it again in 6 months. Well, it's kind of hard to keep people coming. And I know counties are not always built the way other counties are built, and you might not have that flow of referrals coming through. So figuring out what's the best way to do it. Documents. What documents are you using? Who has those documents? How does the family get the documents? Do the family fill out the paperwork? Does the referring entity fill out the paperwork? You got to have that. You got to have a process for it. Who keeps the documents afterwards? Do you shred them, not shred them? You got one central location. Those are things to think about. Data or tracking system. You have your state CRCG data system, but do you have your own? Do you keep your own data so you can show your county or partners what's going on within your CRCG? Susie keeps our data system. We have our own internal data system that she keeps. So she lets our partners know how many referrals they make. She can probably go back over the last 5 years and they can see if their referrals increased or decreased. What were the outcomes of those CRCG meetings? And so how many the ages, the demographics, the ethnicity, the race, all that stuff. She tracks all of that stuff. And then presents that at our yearly retreat. But if juvenile probation, and I was in a call with them the other day, they wanted to see how they've been doing since the pandemic, or pre-pandemic to post-pandemic, we're able to pull those numbers up and show them. So sometimes you got to have the data to get your partners on board, or to identify areas that there are gaps in, right? Because when I get to another program that I'm going to talk about at the very end, we realized we needed some more help on the IDD side. And because we were getting a lot of referrals from IDD. But if you don't have a representative at the table that knows about those services and support, so you got to have the data to back up approaching that entity, even though it's part of your local mental health authority. But the mental health side and the IDD side don't always talk to each other, right? They have their own practices and policies, and so do they. So you have to be able to reach out, and sometimes that data helps you. Follow-up. What is your follow-up plan? How do families know their next point of contact? Is there a way to follow up with that family if something was recommended? Do they have a point of contact? And then surveys. Do you guys do surveys for your CRCG? Does it work? Didn't work? Didn't like the format? Surveys that the families give, the youth give, the adults give helps guide your CRCG and maybe help you to make changes based on their input from how they felt about that particular staffing or how they were greeted, the paperwork, things of that nature. So you want some surveys in there as well. The meeting. So who's present at the meeting when you do a staffing? Does everybody, like if you are a child serving entity, does the family have to be present at the meeting? Yes, no, maybe so. She's shaking her head, yes. Does the family have to be present at y'all CRCG? Okay. Does the child have to be present? Yes. Okay. Does the referring entity have to be present? Okay, yes. So you need to know who has to be there. Who's staffing that family, right? Release of information. Are your release of information HIPAA compliant? Making sure people have signed those release of information. Making sure they're up to date. Making sure you don't have partners at the table who are not on your release of information, right? You don't want to have, I don't know, the little truck that can at the table, and the little truck that can is not on your release of information. So you have somebody at the table that the family didn't know was going to be present, right? The way we do it in Travis County is we list all of our partners that could possibly be at the table, so that the family signs that release. And we have some other sections that they can fill in, so maybe they have a private entity that they use and they want that person to be present. But it's better to have the release than to not have the release, right? So maybe Del Valley ISD said they were going to be there, something happened and they're not there, but we got the release in case they were there, right? So you want a release that represents those people that are supposed to be around the table. Or you have to get another release because you don't want people around the table hearing confidential information, HIPAA-related information, if you don't have a release for that information to be shared. Some entities share their packets that morning. They may have whatever your format is. We review our packets the day of the staffing before the families get there. We have a whole hour and a half where we brainstorm, come up with ideas, questions, suggestions, whatever that is. But everybody's looking at that packet of information, but everybody's on that release. So even if you start in person and you're giving them that packet, they come in, they pick up the packet, read it, there needs to be a release to make sure that they're, one, returning that packet of information and they don't walk out with it. So you have to have processes for that, right? Because sometimes families will give you everything about their kid because they want you to have a good picture of them. So you might have psychologicals, hospital discharges, psychiatric reports, school paperwork, FIEs, functional behavior assessments, behavior intervention plans. You could have a lot of confidential information and packets that are received from families to get a clear picture of what's going on with that child, right? And the same thing with adults. They may provide that information to you as well. So you got to have the proper releases in place. You have to have the proper way to dispose of that information and who's in charge of it. Recommendations. Do you write down anything that you have to give to the family about the meeting? Who's in charge of writing those recommendations or ideas or suggestions down that you're asking the family to explore? Those resources, do they go to the family or do they go to the referring entity? Or do they go to both? Do you have a formal process for that? Visitors, do you allow visitors? This is not the zoo. We don't have a little window where everybody can look in. So you have to have a process if you're going to have visitors come in. Doesn't matter who that visitor is, right? State CRCG has visited Travis County CRCG several times. They still have to go through the visitor process. They still got to sign a release. They still got to get trained on what to expect and what not to expect and what we expect of them. So it doesn't matter who they are. And if we don't have a room for visitors at that particular CRCG, nope, I can't fit you in until, September then, for you can come visit then. So you have to have a process for that. And there are people, and why do you have visitors? Sometimes you have a new person that wants to join and maybe they want to see what the meeting's about. Or I know for us, sometimes there's other CRCGs, the state may say, well, reach out to Travis County. You can see if you can visit their CRCG, see how they run it, facilitate it, whatever, and we've had visitors like that. Or it's new staff that came on board and they want them to visit other CRCGs. I've been to Bexar County CRCG and I visited it and sat in there just to see how they ran theirs versus how we run ours. So visitors do happen, but you gotta have a process for it and the way to track it. What is the ultimate goal of your CRCG? Right? Can you, as a facilitator, say, after COVID, I think Susie could probably attest to this, we had a lot of calls of parents wanting, not after COVID, because I think we still like pre-COVID or post-COVID, wanting to place kids. They're looking for a residential treatment facility. They didn't have no insurance and they didn't have no money. Medicaid doesn't cover it for so long. Private insurance says no. So you have to come up with plans. What is the ultimate goal? It's not always to give families what they want, because sometimes we don't have what they want in the community. So we have to come up with what we have. And how can we help you to still reach whatever goal that you're trying to reach with what we have, right? How can we partner with you, right? Because we don't have a treatment facility, right? I don't have one in my back pocket. So, we have that RTC bed project program, but it still has a wait list, and it's not guaranteed. Waco Center for Youth, it's not guaranteed. So how do we work with these families? So figure out what your goal is. What is the ultimate goal in working with the families? Is it voluntary? Our CRCG is voluntary. I don't know about anybody else's. I think most of them are voluntary. I've never heard of one that was mandated. Even if they're involved with juvenile justice or anybody like that, I tell families over and over again, this meeting is voluntary. It's up to you to decide to be here. Doesn't matter if the court asks you to come. It's up to you. It's up to you to follow through with anything that comes out of this meeting because it's voluntary. Trainings. Train your staff. Train the people that are there. So if we don't have a CRCG, we don't have any kids to staff, we love to take a break every once in a while, but sometimes we might need to bring in a training. Getting people more informed about what's going on out there in the community, more informed about Yes Waiver, more informed about resources or new agencies or new programs that pop up, or even re-educating them on the purpose of CRCG, or re-educating them about non-ed funds and different things that CRCGs do. For those that don't know, non-ed funds come through the CRCG. It doesn't have to physically come to that meeting, but the CRCG coordinator is responsible for signing off on those non-ed funds, or the chair. Waco Center for Youth priority letters, support for HCS diversion slots, state-supported living centers. There's a lot of things out there that CRCG is written in, and if you don't know about it, then you don't know that it's supposed to come through that CRCG and what you're supposed to do. So you gotta be trained on that. You have to ask questions. The state is really good about coming up with trainings. They record them. They have webinars. So if you're not sure, check out the state CRCG website, pull down those webinars, and educate yourselves. I know I've been talking a lot. Anybody got any questions? Okay. Did you have a question? And then if you're a chair of a state CRCG, not a state, if you're a chair of a CRCG or even a co-chair or a leader, they do leader meetings. We do them, is it monthly? Julie, I forget. It's just on my calendar.
Sorry, let me turn on the microphone. The leader meetings are monthly, and it's every second Wednesday from 10 to 11:30, and they're virtual. And we have another question.
Yes, ma'am.
How are the CRCGs that are funded are able to give money to those on the CRCG or chairing the CRCG? Where does the money come from?
Good question. So I'll talk about Travis County CRCG because we are funded. So we have a CRCG coordinator position that is housed at Travis County Juvenile Probation. Behind the scenes, that money comes from our local mental health authority from some type of grant and then flowed behind the scenes through a back tunnel somewhere to juvenile probation, and probation matches or adds to or accepts whatever that funding is to pay for that particular position. Okay? What happened was, when I was the CRCG coordinator, I was at juvenile probation then, so I became the CRCG coordinator. When our CRCG was created, to the best of my knowledge, in 89, I was graduating college in 89. I started probation in 91. The CRCG position has always been at juvenile probation. So it might have been that collaboration among the agencies on how to meet the legislative criteria that was mandated. I haven't seen it anywhere else in my tenure with the county. I can't remember what year we created a secondary position to help the CRCG coordinator position because we were staffing 100 and something kids a year. And so managing that, and then CRCG coordinators, you are the spokesperson for your county. So you're supposed to be doing trainings, you're supposed to be doing going out into the community, representing CRCG, representing your county and things like that. So Travis County Health and Human Services, my home agency, created a second position. They created what we call a CPC liaison, because CRCG in Travis County is called Community Partners for Children. And so they created a second paid position underneath the county. And that is currently the position that Susie has. It has been changed, but that is still the position that Susie has. So that's how we got two positions that directly supports our CRCG. But we also meet twice a month. We also staff, pre-COVID, we staffed anywhere from 90 to 100. I think the most one year we staffed was 110 youth, 120 something youth and families in a year. Our calendar is set for the year. It come before the end of 2023, that calendar is going to get set out so all our partner agencies know when those meetings are. There are a few other counties, like Julie said, there's 5 to 8 counties that have those paid positions. I don't know where their money comes from, but our money comes through Travis County Health and Human Services for Susie's position, and then the one at juvenile probation is a blended dollars position. But it's always been sustained there, because I was there, like I said, I've been at the probation for 20 years, and I probably spent the last 10 or so doing this work. But you'd have to get with, and it's above us, because I guess I'd be considered mid-management, because I have a director above me, and then we have an executive director. It has to be the people at the top that deal with the money to come up with those positions, to advocate, to say, hey, even if it's part-time, like we don't have any money in our CRCG itself, because that's just a meeting. But outside of that, there's other resources and supports that we might be able to tap into. And so the money for positions has to be advocated for. Now, the state has asked for, because I remember the years when they were asking for money to fund these positions. It's just never been done.
We're still asking.
And they're still asking for money to fund these positions, and the legislature just hadn't done it. And so it might be getting grants. It might be trying to get blended positions where you're 75% over here, you're doing this, and 25% of your money's coming from here. It just really depends. Ms. Susie?
So, I mean, this is where your data, your own personal data collection is going to be really helpful to be able to take to your county, city leaders. But for the most part, from my understanding, is it's mostly, these are funded on the county and city level, so the local level of your CRCG. So having that data to be able to present and show the need and show the work that you're doing, and then grants. So here in Travis County, something kind of CRCG adjacent is they got a SAMHSA grant several years ago and did a lot of really great work and created their system of care community. And then our county sustained it because they were able to show the county, look at all this great work we were able to do. And so the county saw the good investment. And so that's the other piece of going with the grant too, or the motivation. If you can even get a short-term grant, that way you can do the work so you can then again show your county city leaders the value.
And then depending upon where your money comes from, like Travis County Health and Human Services is our commissioner's court. So you have to have the people advocating and saying this is good work. The people that present to the court, that do the budgets, that go out there and advocate for more money, wherever it is that y'all's money come from, that funds your position, depending upon where you're working at, there has to be advocacy and there has to be buy-in way above our level. And those partnerships have to be formed and sustained.
You've got local politicians talking about children's mental health and the value of it. Get those people up.
Okay. System of care and CRCG, right? I am a true believer that system of care and CRCG goes hand in hand. That the values of system of care should be the values of CRCG. The original values of system of care, and I have one of the original posters that SAMHSA sent out, it's framed, it's in my office somewhere, was community-based, culturally and linguistically competent, and then family voice and choice. Those are the three basic foundation values for system of care. And when you're working in the CRCG, you're looking at community-based services and supports. We're telling you that family voice needs to be there and be heard. And we want to present things that are culturally and linguistically competent. I wouldn't send a Spanish-speaking family to an English-speaking therapist, right? I wouldn't recommend that even in a CRCG. How's that meeting the needs of that family, right? So no. So the value system, it must be embedded in the work that you do at every level of your CRCG. And as the coordinator, if you believe in those values, it's our job to educate people about what those values are. It's our job when we're facilitating that meeting to look at that least restrictive environment. Can we provide services and supports to this child in the community? Can we provide services and supports that are culturally and linguistically competent? Do we have resources? Do we know of somebody that can do it? Can we bring in somebody? So you're looking at that. And it's looking at, is the family there? Are we hearing what they're saying? So that's the importance also of a chair having help. Because I'm focused on that family when I'm facilitating the meeting, because that's who I'm talking to, right? I'm looking for their little square on my Zoom screen. So I can't be like, hold on 1 minute. I know you was telling me something good, but hold on. Let me see, there's something over here in this chat. Yeah, now, oh, hold on, I got to write this down. You can't do all that because you're not giving that family your undivided attention. So you have to have help, right? And it's not just about knowing the values, it's believing in them. I said this earlier when the parent liaisons that work on behalf of the Children's Partnership were presenting. It's walking the walk of those values, right? It's embedding them within everything that you do, within your agency. And that's the same thing. So within your CRCG, are you community focused? Or are you recommending placement for every kid that comes through because he's having a difficult time? right? Placements may work, short-term hospitalizations may be needed for stabilization. But at the end of the day, where's that kid coming to? Back home, to his community. So we have to include them. And teaching those that we work with, that we collaborate with, that we partner with, that we invite to the table, what system of care is. That should be part of your training, so that they're informed about what system of care is, what the values are, and what it truly means to work with that system of care framework, that modality in your head, to say, we are looking at all of these things, that we're valuing that family voice. I don't care if you Dr. So-and-so, the mama said this. And I want her to be heard, and taking that into consideration, okay? So we want those values instilled in every piece of work that we do. All right? And if you look, community-based, so still talking about system of care and how it's interwoven. Families at the table with a voice. So figure out how you can get lived experience at the table. We're blessed with parent liaisons that all have lived experience that are at every CRCG that we do. We also sometimes have people with lived experience that are also on the table that don't work for Travis County. Okay? So you want to have that parent voice. And how are they interacting? Are they meeting and greet the family? Do they sit up there with the family if you're in person and while they're presenting? What does that look like? Do you have a peer support specialist? Do you have a youth voice? What does that look like? But having people, your CRCG should represent your community, right? So if your community is filled with people of color, you need to have people of color at your CRCG as well. Partnerships and collaborations, you got to have those youth voice. I will tell you now, it has been very difficult to maintain a youth voice at our CRCG. But we continue to strive to try to get there. We had it for about a year or so, year and a half or so. But CRCGs, and I mentioned this earlier, can be very emotionally draining, can be triggering to some people, depending on what your CRCG does and who's coming before and what that family is discussing. Least restrictive environment, whether that's in the school setting or in the community setting. And in the least restrictive environment can be an RTC. Our community has recommended that we didn't feel that this kid would be successful at home until he was stabilized somewhere else. But it's the community that's doing that. It's not Sonia and all her wisdom that's doing that. I'm getting everybody's input on that, and even the family's input on that. Right? CRCGs were created to serve those that were falling between the cracks, no matter how many entities were touching their lives. It is the purpose of that community. It is purpose. So the first C in CRCG is community. So let's connect with our community. Let's bring in those providers. Let's find those nonprofits. Let's find the people that you can bring to the table. They don't have to work for a state agency. What's going on? Go to that community, right? If I lived in Lago Vista, which is probably 45 minutes to an hour from here, but I'm serving kids in Austin, Travis County, then I need to know what's going on in Austin, Travis County. I need to come visit it. I need to check it out. I need to see what's really going on in the community, because Lago Vista looks way different than Austin, Travis County. Even though it's all Travis County, it's going to look way different. Your services and supports are going to be different. You got to know what's going on so that you can make the right recommendations. You know, you need to know how far services are from where the families live. You don't want to recommend something that they're going to have to take 10 buses and 2 trains to get to. The R in CRCG stands for resources. What resources do you have in your county? What can you come up with? How creative are they? Can you get people to buy in? Can you get people to offer a resource? Even if there's a little wait list, it's something that the family can consider. I don't ask families to make any commitments to anything that's offered in that CRCG. I'm talking to that family for 45 minutes. Don't make a commitment. These are ideas. These are suggestions. There's somebody that's going to meet with you afterwards that can talk to you a little bit more in detail, get to build that rapport, build that relationship, get with your other providers so that you can determine what you want to follow up on. But you got to have resources to offer. And I know that there are small counties with minimal resources, but tap into those minimal resources. Tap into some natural resources and supports that are out there for families to get involved with. Resources that are new or unidentified. Connect with and educate resources about CRCG and system of care. Sometimes your resource are the people that are around the table. That's why you're always looking at who's at the table. The second C stands for coordination. You have to coordinate with the people that are there. Some of that coordination means more than just a chair. I've preached this, and I'm going to continue to preach it because I sit and I listen in those state CRCG leader meetings where chairs are doing everything, including the kitchen sink and the dishes, by themselves. And they got a table of 15 to 20 people that aren't volunteering. If you got a connection to juvenile probation and probation isn't showing up and that chair hasn't had any luck, then step up and say, I'll do it. Let me check in with somebody that I know over there so I can make sure you're connected to the right person, right? That coordination is ever important because at the end of the day, the right people at the table provides the right services and supports for the family, right? And one person can't do it alone. If that was the case, they wouldn't have created CRCGs. If one entity could do it by itself. And the last stands for group. You want a group of people with like-minded goals, a system of care belief systems that come together to serve their community. Because I didn't have to say I'd be the chair of CRCG. I got a whole job at Health and Human Services. And this takes up some time to be the chair of a CRCG. So you have to have that commission and that passion to do the work, that are open to partnering with parents and with caregivers, willing to listen and share and offer. People that are non-judgmental. Parents don't want to come to a meeting if you're judging them on everything that they've done wrong. That's not what I came to a meeting for. And that I provide a safe environment for them. All right, in summary, you guys can see this. It's a brainstorming session is what a CRCG is. And when you're brainstorming, you're throwing out multiple ideas, resources. And I tell families all the time that this may or may not be a best match for your family, but it's something to explore. I'm not making promises. I'm giving them something else to look at, something else to add to their toolkit, something to revisit. Because what that kid did when he was 6, and he's now 15, maybe he didn't like it at 6, but maybe he'll like it at 15. So there's nothing wrong with revisiting old resources and supports. To identify, are there culturally and linguistically supportive services out there, and how do we do that? Because that also tells the state, where are the gaps? You know, and when you're doing staffings, if you have a family that speaks a specific language that's not Spanish, because Spanish and English are typically the two we have translators for or interpreters for, you have to do the work to figure out who is going to interpret for this family in this meeting, right? You still got to have a meeting. Just because you don't have an interpreter, you got to figure that out. And you want a professional interpreter if you can. You don't want the neighbor or the kid interpreting for the family. You want to bring in a professional if you can. Provide a place where family and youth voice is respected, okay? You got to have that spot. And to do the best to meet the needs of the families that come before us. I went through about 2 months of CRCG staffings, and I was telling my director, I said, I'm feeling useless, because they were so challenging that we didn't have the supports and services that the families needed. And they were, for some of the programs, they were way, way, way over the income limits. right? But they were still struggling. They were still falling through the cracks. And even though families were thankful, me personally, I felt like, I don't even know if I helped that family today. So you have to, sometimes it's us that CRCGs are taking a toll on. And we need to be reminded that we're there to do the best that we can for these families. So I'm going to talk briefly about Travis County. I've already said we've been a CRCG. Originally, CRCG in Travis County was a standalone meeting. It was by itself. So Susie mentioned we got a SAMHSA grant from 1998 to 2005. I was not a part of that grant. I can't take credit for it. But all of the entities that were originally involved in that grant, and these were, you know, these were like the chief of juvenile probation, the chief over integral care, which is our local mental health authority. These were people who could commit money and make decisions. They all planned and got together and created a sustainability plan. They talked about it every year of that 7-year grant. So when it was time for that grant to end, what they did was they combined 3 staffings into 1, which is why we call our CRCG in Travis County Community Partners for Children. Because what we saw was families would go to CRCG for a staffing. If they wanted to do the Children's Partnership, which is the System of Care program, they go there for a staffing. And then we also have some funding through the county that pays for short-term out-of-home placement. And then they would go to there for a staffing. And then they might get sent back to the very first staffing that they went to. And so they combined them. So our CRCG is the gatekeeper for 2 other programs. It is the eligibility meeting for our Children's Partnership program, which provides wraparound services to families utilizing care coordinators and the parent liaisons. And then it also determines whether or not a family meets criteria for short-term out-of-home placement at a couple of the facilities that we contract with. So it's not just to give them resources, it's also to determine whether or not families meet the criteria for those 2 particular programs if they are seeking that. Okay? We have 1 chair, which is me, and I have a backup. We have 2 full-time CRCG care coordinator positions. Courtney is not here. She's at juvenile probation. Susie is at Health and Human Services. And we just got a brand new position that we haven't filled yet. We got interviews on 31st. And that position will be supervised by Susie, but they would help with the screening and the referral process and also offer short-term case management to families. So they will be there to substitute and help the CRCG. We are a child-serving CRCG, 0 to 22. Our average age is about the average age of most people, 13 to 17. I think the youngest age we've ever staffed is 4. The oldest is 21, 22. We have a referral form, and at the very end of the presentation, you're going to see everybody's contact information. And if you look in Susie's contact information, you're going to see a couple links that you can type in. One will take you to an inquiry form that tells her that somebody's interested in having a CRCG staffing, and the other one takes you to our internal website at Travis County that talks about CRCG and the forms. We have a family guide. There's a release of information. And earlier, and I was joking, he was in the meeting earlier, and so were you, and I was like, I talked about Susie a lot, and I said, y'all can admire her from a distance, but you can't have Susie. She did a lot of work to ensure that our releases of information were up to par, not only with HIPAA, but with FERPA and a whole bunch of other initials that I don't know, to ensure that we were in compliance, especially during COVID, when a lot of stuff was done virtually when it came to releases. We have membership forms that are redone every year at our retreat. She also ensures new members get those membership forms, and we also have a visitor policy. The other thing I wanted to add in there when you guys are talking about your CRCGs, make sure you have a policy regarding a crisis. So we had to create this policy because we had a young man that was suicidal or had thoughts of suicide, of committing suicide, or made reference to that in the staffing. So we had to come up with a process of how do we handle that if that happens during a staffing. If we know a parent is under the influence or anything, we're not having to staff it. So you have to have some policies or some practices in place for that as well, and some identified people to check in with that person, especially if you're in person or even virtually. So we have a couple licensed staff that attend CRCGs, and they agreed to be those check-in people if a situation like that happened again. You have to have committed members. You have to nurture those relationships. It's not easy keeping all these partners at the table. I'm gonna tell you that now. It's not easy. We go out and do resource fairs. Susie goes out all the time during trainings. She has to go back. She tries to get on everybody's calendar to remind them. You know, I do trainings. It's not easy. It's work. But you got to put the work in there so that the partners can see that it's worth them coming. And you got to tell them why it's important for them to come. We meet twice a month, the second Wednesday and the fourth Thursday of every month. Our meetings are on Zoom. We have written recommendations. So Courtney, who's over at Juvenile, she writes the recommendations, and she actually reviews those recommendations with the family and provides them a copy of it. And then we have a designated follow-up person. So whether that follow-up person works on behalf of the Children's Partnership, or whether it's somebody that's identified in the meeting to check back in with that family, or it could be that Susie's gonna follow up with them and connect with them. It just depends. We do a yearly retreat. At that retreat, we look at our bylaws. We also vote for the chair. Every 2 years, we vote for our chair. We update our bylaws as needed. We have an executive committee and an advocacy committee that comes out of that retreat too. So the retreat is for all of our partners, and they may have suggestions, ideas, they may have questions, whatever it is, it comes out of that retreat. And the executive committee, and we have to have partner agencies, you know, represented, and it's in the bylaws who needs to be on that. And there's a family voice in all of those committees. The advocacy committee is more, what are things that need to be advocated for on behalf of? I work for a county entity. I can't always advocate for something. Sometimes I gotta watch my mouth. So, but the advocacy committee, I think they played an important role, as well as our data, in getting a care coordinator for the Children's Partnership in our IDD division. Because we were getting all these referrals, but we didn't have anybody that had the knowledge to work with them. So, you know, you gotta have somebody that's advocating besides the chair. So these are entities that should be at the table. And these are our current partners that are at the table. Challenges. I love my CRCG, but we got challenges. Even in Travis County, we got challenges just like every other county does. Youth voice, I talked about that. Family voice outside of the staff that work on us. We used to have a couple members that were straight family voice. That's what they came for, and getting that back. Sustainability of partners. It is a job. It's a job sustaining your partners. Calling them up if you hadn't seen them for a while. For DFPS, and they're a very good partner in regards to us, they rotate 4 staff through our CRCG. Right? So every staff isn't committed. Maximus, and they presented earlier this week, they have 2 or 3 staff that they rotate through CRCG. So sometimes you just gotta have multiple people coming and they're rotating through, because you can't get that commitment from one person. ARC of the capital area, he has 2 or 3 staff rotating through. So it's really just being creative with that and saying, hey, well, I know you can't commit every time. Do you have a second person? And that's okay. It doesn't have to be the same person at every meeting. Capacity to serve. You know, do they have the capacity to be there? Bridging the gaps with community needs and changes is always a challenge. And then capacity to serve could also be, are there openings to serve this family? If we're saying we're gonna connect them to this, this, and that, are there openings? We know since the pandemic, providers have been shortened. People wanting to go back into people's home has been shortened. You know, finding therapists, finding workers. At one point I was like, does anybody wanna work? You know, and so that's a capacity to serve too, because needs are out there, but it's finding the people to do it. And I don't know about y'all, but in Travis County, respite is almost non-existent. Finding respite providers. So looking at that. And then expansion of community collaborations. We gotta keep expanding because there's new things that are coming. Our community is ever changing. And so you have to be aware of that so that you can expand those collaborations. Collaborating with Asian, we have an Asian cultural center. So collaborating with them, seeing if they can provide any services or supports. They also provide refugee services. So you're looking at that. Collaborating with those, or even knowing about those that provide human trafficking training or supports to parents of kids who may be suspected of being trafficked. So you have to be aware of the things that are changing in our community so that we can advocate or go out and at least connect with those agencies and see if there's a point person that we can get resources from or how to make that referral. Coming together is a beginning, staying together is progress, and working together is success. And that is what it is all about. Success is defined by the family. And you, like I told y'all earlier, I felt like I was hopeless. Those families probably thought I was the best thing since ice cream. It's defined by them. Any questions? 'Cause I've been...
You said that yours goes up to age 22, so is each one a little bit different? Each county is going to be different in terms of what age that they go up until?
Yes, ma'am. It's going to be
Okay.
different. If you go to the state CRCG website and you put in the county, it'll tell you who the chair and co-chair is and who their point of contact is. And sometimes I believe it'll tell you if it's a child serving entity, a family serving, or an adult serving. For our CRCG, the child is the person that is being staffed. So they are the one that has to have the needs and meet the criteria, not the family or the parent, but it's the child.
Okay, because I'm in the FEP, and we have individuals aged 13 to 33. So do you have any suggestions if there's somebody that's older than, if they don't meet the criteria for the age, and we have somebody who has complex needs and they're not really appropriate for our program, do you have any suggestions then on what to do?
Connecting them to resources in the community and making calls. So if a family calls Susie and this has happened, a 28-year-old, she's gonna be like, hold on, let me see if I can find something, or she may already know at the top of her head because she's already connected to some people about some programs, and then she's gonna refer that family and give them those resources. And she may say, I'll follow up with you in about a week or two and let me know how that worked. So you have to have the ability to give them that resources, or say, I may not know right now, but let me do some calling and then I'll call you back and give you some ideas or suggestions. And when we're bringing an older adult into our CRCG, Susie typically will call older agencies that work with older adults and see if we can get them at the table. Because the majority of the agencies we have there are child serving.
Okay.
And so it may be calling in some of those other agencies that work primarily with adults, or at least getting that information, or having them come to the table for that particular staffing at that particular time.
Okay, all right, thank you.
You're welcome. All right, I know we are at our 4:30 time limit, and I know that Julie will do this, but don't forget to scan the QR code so that you guys can do the evaluation. Also, don't forget to mark your conference sheet that tells you which one you went through so that you can get credit for that in your CEUs. I want to thank you all for staying till 4:30. I appreciate that. Don't forget we have the event this evening. People are standing out there for the shuttle already. And I wish you guys a great and wonderful afternoon. Anything to add, Julie?
I just wanted to add, if you're interested in going to the networking event, you can check the registration desk. You'll need a red wristband. And again, there's no charge. It's free. There will be food, games from 5:30 to 7:30. But most importantly, let's give Sonia a round of applause.